Bismillahirrahmanirrahim. This is our part 2 of Ospe joints and ligaments. This is shoulder joint, or you can say glenohumeral joint. The glenohumeral joint specimen, and the capsule attaches to the margin of the glenoid cavity and anatomical neck of the humerus. The roof is formed. Roof show the structures forming the boundaries of the carpal tunnel. What are the boundaries that form the carpal tunnel? Roof is formed by the flexor retinaculum. Floor is formed by the carpal bones. Concave sulcus and contents are median nerve, flexor tendons. Median nerve is basically the content of the carpal tunnel, but ulnar nerve do not passes from the carpal tunnel. Okay, this is an important point. Ulnar medial collateral ligament is present on the medial epicondyle, coronoid and olecranon process. Radial collateral ligament, these are the ligaments of the shoulder elbow joint. Okay, these are the ligaments of the collateral ligaments of the elbow joint are ulnar collateral ligament, radial collateral ligament. Ulnar collateral ligament is present on the medial epicondyle, coronoid and olecranon, and radial collateral ligament is present on the lateral epicondyle, annular ligament of the radius. And the point out the acromioclavicular joint and mention its type. Its type is plain synovial joint. Acromioclavicular joint कहाँ पर होगा आप बताइए. एक्रोमियन प्रोसेस ऑफ स्कैपुला एंड क्लैविकल उसके बीच में होगा. ठीक है, वो मैंने ऊपर मिस कर दिया था, वो मैं आपको दिखा देती हूँ कहाँ पे होगा. ये वाला होगा एक्रोमियोक्लाविकुलर जॉइंट. ठीक है, ये एक्रोमियन प्रोसेस है. ठीक है, और ये कोराकॉइड प्रोसेस ऑफ स्कैपुला है. और यहाँ पे क्या बनेगा, स्टेर्नोक्लैविकुलर जॉइंट बनेगा या कॉस्टोक्लैविकुलर जॉइंट बनेगा. ठीक है, दोनों एक ही नाम है. Muscles. Okay, now let's talk about the muscles. Identify the muscle tagged on the specimen. Bicep brachii muscle can be marked and its nerve supply can be asked to you. Musculocutaneous nerve, deltoid muscle can be marked. Axillary nerve supplies a deltoid muscle. Bicep brachii action is supination and flexion of the forearm, and demonstrate the muscles of the thenar eminence on a model abductor pollicis brevis, flexor pollicis brevis, operans pollicis. F2O all are supplied by median nerve except deep head of the flexor pollicis brevis may get the ulnar. Point to the supraspinatus muscle on the scapula where it is going to be present on the posterior side, on the anterior and posterior side, and supraspinatus. The spine is dividing the posterior side into two fossa, supraspinatus fossa and infraspinatus fossa. So on the supraspinatus fossa, supraspinatus muscle will be present and its action is abduction. As you very well know, 0 to 15 degree supraspinatus muscle performs the abduction. Occupies the supraspinatus fossa, initiates the abduction 15 degree, which I have already told you. I haven't seen it. Okay, it is supplied by the suprascapular nerve. Flexor digitorum superficialis tendons at wrist cross section. It lies in the carpal tunnel. Tendons are in pairs to digits 2 to 5. Action flexes at proximal interphalangeal joint. PIP, where PIP comes, it means proximal interphalangeal joint. Okay, neurovascular structure. Median nerve is formed by identify the median nerve in the axilla and name one muscle supplied by it. What is that? ये तो आप बहुत, it's very easy. Median nerve is present, is formed between the two, formed by the lateral and medial cords, and it is present between the two heads of the pronator teres. And radial artery can be palpable at the anatomical snuff box, and it is palpable between the tendons of extensor pollicis longus and brevis. It lies on the scaphoid bone. Once you identify the scaphoid bone, you can easily identify the radial artery. Okay, what is this? This is wrist drop. Yes, shabash. This is the fracture of the humerus, so radial nerve injury takes place. So this is the wrist drop. Fracture of the surgical neck is the axillary nerve. A patient presents with the wrist drop. Which nerve is affected? Radial nerve, posterior compartment of the arm. Extensors of the arm are going to be affected. Enters the wraps around the radial groove. Enters the forearm, posterior interosseous branch. This is the root of the radial nerve basically. Okay, now I have already told you that beyond 15 degree abduction is performed by the deltoid muscle, which is supplied by the axillary nerve, and its function is flexion, abduction, extension, weight lifting, lifting of something. Show the site for IM injection. It is present at the midpoint of the deltoid, about 2 to 3 finger below acromion process. Avoid axillary nerve. Axillary nerve can get damaged. It means that it is present near the surgical neck of the humerus. So try to avoid the injury of the axillary nerve. And this question is very important for every discipline. It can be made on the interactive station to identify the point of the IM injection where it should be given. The flexor retinaculum of the wrist forms the roof of the carpal tunnel. The following structure passes beneath it through the carpal tunnel. The tendons are flexor digitorum superficialis tendon, flexor digitorum profundus tendon, flexor pollicis 1 tendon, flexor carpi radialis 1 tendon. Median nerve is present. Total 10 structure, 9 tendon and 1 nerve. Ulnar nerve and artery do not pass through the carpal tunnel. They pass superficial to the flexor retinaculum in the Guyon's canal. It is very important. You must know about it. Okay, it is a very favorite question, and it's asked for the distinction person. Okay, the flexor retinaculum transverse carpal ligament lies at the wrist and forms the roof of the carpal tunnel. The following structure passes beneath it inside the carpal tunnel. 4 tendons of flexor digitorum superficialis, flexor digitorum profundus, 1 tendon of flexor pollicis longus and flexor carpi radialis in its own compartment, and 1 nerve, median nerve. Ulnar nerve and ulnar artery do not pass through the tunnel, rather they pass superficial to the flexor retinaculum in the Guyon's canal, which I have already told you. One other question that is very important that can be asked in the BCQs as well, that is flexor digitorum superficialis. Each tendon splits into 2 slips. This is known as Camper's chiasm and inserts at the sides of the shaft of the middle phalanx of the medial 4 fingers. मीडियल 4 फिंगर्स के साइड पे लगेगा मिडिल फेरिंग्स के फ्लेक्सर डिजिटोरम सुपरफिशियलिस, जबकि फ्लेक्सर डिजिटोरम प्रोफंडस इंसर्ट होगा आपका डिस्टल फेलिंग्स के बेस के ऊपर ऑफ द मीडियल 4 फिंगर्स. फ्लेक्सर पॉलिसिस लॉन्गस, पॉलिसिस मीन्स थंब, सो इट इज गोइंग टू बी इंसर्टेड एट द बेस ऑफ द डिस्टल फेलिंग्स ऑफ द thumb. So the summary is middle phalanx flexor digitorum superficialis, distal phalanx flexor digitorum profundus, and profundus means deep muscle, and flexor pollicis longus towards the thumb. Okay, now the another question can be given to you in the exam, that a diagram of the brachial plexus can be given to you, and 5 terminal branches can be asked to you, that is musculocutaneous nerve, radial nerve, ulnar nerve, median nerve, and medial. Okay, now you can see the dorsal C5, C6, C7, C8. Dorsal scapular nerve arises from here. This is very important, and long thoracic nervus passes down, and this is the from C7 subclavian nerve arises. Cords are lateral cord, posterior cord, and medial cord. Here it is written over. It is written medial pectoral nerve. This is medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm. USN means upper subscapular nerve. TDN means thoracico-dorsal nerve, and LSN means lower subscapular nerve. MC represents musculocutaneous nerve or axillary nerve. Okay, so axillary nerve, you better know about it. Okay, that's it. Please do not forget to follow and subscribe my channel to get such important and latest videos regarding the Viva's Ospe related questions. Thank you.